This is part 3 in continuation with part 1 and 2 of alcohol, which were posted earlier, and where I had discussed mostly about brief history of alcohol use, alcohol withdrawal syndrome, some screening tools like SIVA, MINDS, and alcohol use disorder. In this part, we shall cover pathophysiology of alcohol withdrawal syndrome, how alcohol works in brain, and how chronic use of alcohol causes alteration in some receptors. Imagine you have a perfectly balanced horizontal line, and on one side of the line you have inhibitory neurotransmitter GABA, and on the other side of the line you have excitatory neurotransmitter glutamate. This is the situation in our brain under normal condition. In other words, in the absence of alcohol, both the inhibitory GABA and excitatory glutamate are cancelling each other's effect and maintains this homeostatic equilibrium. Now, the way to remember GABA on one side and NMDA on the other side, one is inhibitory, one is excitatory. I made a small simple mnemonic where GABA stands for, as if GABA is standing for uh, grab a bottle of alcohol, and NMDA stands for no, my parents don't allow. You know, so this is basically the balance between inhibitory and excitatory neurotransmitter, the way to remember. Now, alcohol is a chemical which loves GABA and hates glutamate. Glutamate actually latches onto the NMDA receptors. When someone starts drinking, uh, like let's say, and looking at this balance, and someone start drinking, and which way you think the balance is gonna shift, so of course it's gonna shift more towards GABA because alcohol loves GABA, you know. So what will happen? The balance will tilt towards left. So this is what happens inside a person who starts drinking alcohol. Since the combined effect of the inhibition of both GABA as well as alcohol exceeds the excitatory effect of glutamate. Now, drinking occasionally in small amount, this balance does not tilt that much. In other words, there is very little inhibition, but however, acute intoxication of alcohol can shift this balance very quickly. And clinically, this tilted balance is manifested in the form of ataxia, stupor, and slurred speech. Now, the question you should ask is how long this balance will remain tilted. Technically, if we keep drinking alcohol, then the balance should remain tilted towards left. But fortunately, it does not remain like that for a long time. Nature tends to keep things in equilibrium. Anytime you disturb any balance, it's going to bounce back, especially if the changes are made suddenly or quickly. The opposite is going to happen quickly as well. But sudden changes are not good for body. Sometimes it can put the body's internal equilibrium out of control, and that can lead to uh, metabolic complication. However, if the changes are made slowly, the equilibrium can reestablish itself slowly with fewer complications. Now, looking at this figure, if you keep adding alcohol to the body, I mean, if you keep drinking daily for a long period of time, then how can the balance tilt itself back towards normal? Unless, let's say, you add glutamate on the right side of this equation, let's say, in order to balance. But in order to do that, we are not going to drink glutamate, But fortunately, our beautiful body make necessary changes in the population and shapes of the receptors in such a way where like where the chemicals attach on the receptor, body making the changes, um, you know to bring the balance back towards normal. But remember, this will not be the same normal as the original normal. It will be a new compensated or new adapted normal. The chronic and regular consumption of alcohol alters the receptor profile in such a way that they the molecule is not able to act upon it properly. Now, alcohol acts upon GABA receptor on the postsynaptic neuron in a way. When someone is drinking, let's say 4 or 5 beers every day, you are constantly bombarding those GABA receptor and you are overexposing them, because presence of too much GABA is going to over inhibit, which our body doesn't like. Therefore, body starts internalizing GABA receptor. They start disappearing, and over a period of time, the number of GABA receptor decreases. This is called down regulation. Similarly, the exact opposite happens during upregulation, where body makes more number of NMDA receptors over a period of time when there's not enough amount of glutamate circulating. Remember, alcohol was antagonizing glutamate. Now body tries to grab whatever little amount of glutamate is available. So it does so by increasing the population of the NMDA receptor, and this is when the receptor number goes up, we call it upregulation. Here think of as if more of the NMDA will show up to protect from um, antagonizing effect of the alcohol. Remember my mnemonic, no, my parents don't allow me to drink alcohol. So basically, if you're looking at this balance on chronic use, we have two adaptations occurring here simultaneously in the body. On one hand, the number of GABA receptors is going down, and on the other hand, the number of NMDA receptors is going up. And by changing the population of receptor, body is trying to maintain the homeostasis. Now, it's very important to understand this down regulation and the up regulation, because that will be helpful us understanding when the person goes through the withdrawal state. Now, looking at this figure, if we remove alcohol, look at the left side of the equation. If you remove alcohol, I mean, if the person stops drinking suddenly, um, that means you are removing or you're decreasing the inhibition. Therefore, the balance will tilt towards right. This is the picture. That's how it is gonna look. Now, as we have less inhibition and more unopposed excitation, NMD receptor, which will be manifested as patient having, an excitation of the NMDA receptor will be manifested as like a tachycardia, sweating, or tremors, or some nervous excitation, mainly seizures. And some of these patients, they go into delirium tremors during withdrawal. This is basically overactive autonomic nervous system, and this can happen with any drug which is inhibitory in nature. Now, clinically, the symptoms manifested during withdrawal state are exact opposite of symptoms which were observed during acute intoxication. See, in acute intoxication, we had ataxia, stupor, and slurred speech, which was because of the over inhibition, whereas in excitatory, we have tachycardia, sweating, tremors, seizure, and DTs. Now, uh, this one actually, I combined all the previous figures into one. Let's go back to previous slide and look at the withdrawal symptoms. Now, let's see it now. Once patients start manifesting the withdrawal symptom, knowing the time course of onset of symptom is important, because treatment of alcohol withdrawal is based upon severity of the symptom. You can calculate the SIVA score, and based on this score, you can decide whether to give them treatment like benzodiazepines or to hold it. Now, if the SIVA score between 0 to 9 means the withdrawal is minimal and treatment may not be needed, whereas if the SIVA score is 10 to 19, it indicates they have mild to moderate withdrawal. And if the SIVA score is 20 or greater, it means they're going through severe withdrawal, and they most likely they definitely need the treatment, and some of them will go into DT if you do not intervene early enough, and the DT can cause permanent damage in the brain. And if you want to know more about like the SIVA scoring, please refer back to my previous lecture on alcoholism. Now, let's go briefly over the severity of the alcohol withdrawal and the time course of withdrawal symptoms. Now, this slide actually represents the time course of alcohol withdrawal symptom based upon a study by Dr. Haber et al. In 2009. Now, on the vertical axis, we have severity of withdrawal symptoms, and on the horizontal axis, we have the time of expression of the symptom. Now, the green line here represents a minor withdrawal symptom, which usually start around 6 to 12 hours after last drink. Now, and these last anywhere from 24 to 48 hours. The minor symptoms mostly are like headache, mild anxiety, insomnia, shakes, tremors, upset stomach, lack of appetite, sweating, irregular heartbeat, tachycardia. And from the SIVA scoring point of view, these mild symptom corresponds to score of less than 10. The light blue line here represents moderate to severe withdrawal symptom, which begins from like 12 to 24 hours afterwards, after stopping drinking. These patients complain of hallucination, especially visual hallucinations are more common. Patients start seeing things that are not there. They often see animals in the room. They hear things. The hallucination can be tactile also, and these symptoms they last from 24 hours to 6 days. But patients are, remember, these patients are well oriented and they have clear sensorium and stable vitals. One thing I would like to emphasize here is that alcoholic hallucinations, the dark blue line which is representing that here, uh, they are usually observed anywhere between 12 to 48 hours after cessation of alcohol drinking. Now, it's important to recognize and distinguish alcoholic hallucinosis from other hallucinations because it's a unique syndrome, visual hallucination, but the patient's orientation is intact, which means even though they are having visual hallucination, but they are alert and oriented. They know their name, they know where they are, the name of the year, and usually they know what's going on even though they are going through withdrawal. And it's very important to understand alcoholic hallucination. Important point to remember: alcoholic hallucination, the patient orientation intact, whereas in delirium tremens the orientation is impaired. Now the dotted yellow line represents that there might be one or two generalized tonic-clonic alcohol withdrawal seizures which can begin within 6 to 48 hours after the last drink. Sometimes multiple seizures up to 6 can occur within a span of 6 hours, and there is a high risk of progression into delirium tremens. The red line represents DT, which starts about 48 to 96 hours after last drink. Now, DT is a serious life-threatening emergency which must be recognized and treated immediately. DT patients are extremely confused and disoriented. They have altered sensorium with hallucinations and illusions. They, they are sweating, have tremors, they have rapid heart rate and anxiety. All the basic brain functions get disturbed. They are agitated because of all the withdrawal symptoms which began earlier around like 48 to 72 hours after the last drink, and this may last up to sometime to 2 weeks. Uh, from the SIVA scoring point of view, looking at the DT usually correspond to a SIVA score of greater than 20. Uh, I apologize for a lot of information on this busy and complicated slide, but it's a high yield slide. In the next lecture, we shall continue with some other alcohol associated pathophysiological changes in the body. Thank you for watching.